Greetings and welcome to the webinar, Reducing Airborne Viruses in Schools, Optimizing Ventilation and Energy Efficiency. My name is Sheila Brown. I am with the United States Environmental Protection Agency in the Indoor Environments Division. And I am honored to serve as your facilitator for today's webinar. Next slide. Thank you for joining us today. Let's walk through a few instructions before we begin. Please take a moment to familiarize yourself with the webinar control panel, menu, and options. You can use the GoToWebinar control panel to customize audio options. The sound will default from your computer speakers, but a phone-in option is also available. This phone line is not toll-free. Please note, all participants are in listen-only mode and will be unable to unmute. You can use the GoToWebinar questions or chat pane to submit questions, comments, and any tech help requests. You can also view helpful resources which will be shared via the webinar chat. To save the chat at the end of the webinar, select File and Save Questions Chat Log. There will be a question and answer period immediately following the webinar presentations. Next slide. Wow, we have an exciting lineup of speakers and presentations designed to help you apply findings from school air quality research and guidance on ventilation, provide clean and healthy air in schools while considering energy efficiency, train school facility staff with a new online training focused on indoor air quality, ventilation, and filtration, implement best practices used by an award-winning school district. Next slide. Before we dive all the way in, I will quickly review the IAQ, Indoor Air Quality Tools for Schools, suite of resources that EPA has developed to help schools implement and sustain effective and comprehensive IAQ management programs. The IAQ Tools for Schools guidance has been implemented successfully in tens of thousands of schools nationwide. You can explore our resources and tools on our EPA School IAQ website, and the link for that has been put in the chat. Next slide. One of the best ways to ensure a healthy, clean, and safe indoor environment is by implementing a comprehensive indoor air quality management plan using the Indoor Air Quality Tools for Schools Action Kit. Note that action is in the name of this resource, action. This wasn't meant to be guidance on the shelf, like an elf on the shelf. We wanted people to utilize this guidance to identify issues, collaborate among their teams, and take specific actions to address indoor air quality concerns in the school environment. This kit was developed with checklists, fact sheets, and a variety of supporting materials to help you institute solid, sustainable practices and policies that address current IAQ issues and tackle future environmental and health challenges. Next slide. EPA also offers a free, ongoing IAQ professional training webinar series, all of which are available online to view on demand at your convenience. The IAQ Masterclass series is designed to provide robust, foundational technical knowledge to start, improve, or sustain an IAQ management program. The IAQ Masterclass Professional Training Webinar Series comprises 10 one-hour technical, web-based trainings designed to provide school district staff the knowledge and tools they need to execute an IAQ management program. Complete all 10 masterclass webinars to receive a certificate that recognizes your efforts toward IQ mastery. In addition to the IQ Masterclass series, we have over 20 other on-demand webinars that focus on creating healthy learning environments and build capacity to take immediate action. After completing the evaluation for each training, you can instantly access your certificate of completion. Next slide. Oh, the wonderful framework. The framework for effective school IQ management demonstrates how school districts can implement the action kit using 6 key drivers and successful strategies for continuous improvement. This is your blueprint for implementation. These drivers will look familiar to you because they are a system for continuous improvement and a continual process, not a linear process. While all of these drivers continue to work in tandem, and they may look different at different times. Next slide. In addition to the framework, the Action Kit offers 7 technical solutions that show schools where to start. These are the major IQ issues that the Action Kit and framework can be used to address to achieve reliable, clean, efficient, and healthy indoor environments in schools. All of these strategies are interdependent and require a coordinated approach. For example, today we will focus on operations and maintenance, HVAC improvements, and impacts on energy efficiency. However, a successful guidelines-based plan requires considering things like mold and moisture, control and regulate humidity levels, smart material selection when purchasing equipment, and aggressive source control to reduce the level of contaminants and give your HVAC systems a fighting chance. Next slide. In general, a well-designed indoor air quality management plan includes control of the sources of airborne pollutants, improved ventilation, introduction and distribution of adequate outdoor air, if needed, providing enhanced filtration by using the central HVAC system and/or in-room filtration devices. The speakers today will focus on how ventilation and filtration can help reduce exposure to airborne viruses and bacteria. Next slide. I will quickly review the latest guidance from EPA, specifically to prevent the spread of respiratory viruses indoors. EPA's guidance for school districts is consistent with guidance from health, environmental, and building science experts like ASHRAE and CDC. The guidance hinges on 3 proven approaches of increasing ventilation rates, enhanced filtration, and supplemental ventilation with portable air cleaners. Let's start with ventilation. The goal is to ensure, to the greatest extent possible, minimum ventilation standards such as ASHRAE 62.1 are being met throughout the campus. This will likely need to be done in consultation with professional staff. In addition, ASHRAE 241 should be followed when the school is in a pandemic mode. In situations where it is difficult or not practical to meet minimum standards by bringing in additional outdoor air, evaluate the use of portable air cleaners and upgrades to the HVAC filters, such as MERV 13 if possible, and potentially supplement with portable air cleaners. Once the system is meeting minimum ventilation standards, and any additional ventilation goals above the minimum standards are in place, ensure proper staff training for operation and maintenance of the system. And Hannah will review a new training course for schools that specifically cover ventilation. Hannah Carter, that is. In addition to ventilation and filtration improvements, a multi-layered approach can involve the use of administrative controls and cleaning and disinfection practices. At EPA, we developed this technical guidance infographic to help schools operationalize the CDC guidance by providing simple strategies to jumpstart your IAQ issues and quickly respond to issues no matter how simple or complicated. You will find in the chat some additional information regarding the infographic and regarding ASHRAE standards. Next slide. Today, we are fortunate to have a tremendous slate of speakers. Our speakers will be presenting on school air quality research data, school assessment survey results, the new online indoor air training course created for school staff working to provide clean air in their facilities, and specific case studies data that was used to improve school indoor air quality in Denver public schools. So at this point, I would like to introduce our first speaker. Dr. Joseph G. Allen is an associate professor at the Harvard Chain School of Public Health and the director of Harvard's Healthy Buildings program. He is a co-author of Healthy Buildings, How Indoor Spaces Can Make You Sick or Keep You Well. During the COVID-19 pandemic, he served as the commissioner of the Lancet COVID-19 Commission and chair of its Safe Work, Safe Schools, and Safe Travel Task Force. Dr. Allen is an editor for two journals, the Indoor Environments and Journal of Exposure, Science and Environmental Epidemiology, and has authored over 100 peer-reviewed scientific papers. Take it away, Dr. Allen.
All right, thanks so much. A really nice introduction. Great to be here with my colleagues. If I can ask the moderator to just bring up that prompt to let me share my screen, I can do that for you. It's a play. I've worked a lot with the U.S. Green Building Council Center for Green Schools, so it's nice to be here with them and the Denver Public Schools and the Indoor Environments Division at the USCPA, which is just terrific. All right, terrific. Yeah, so I'm going to try and keep this interesting and bring in some of the research and what we know about healthy indoor environments for schools. It starts with good ventilation, filtration, and source control, as you just heard from the EPA. I want to talk about infectious disease transmission and really what's happening in every classroom and also every indoor space, and some fundamental shifts that have occurred as a result of the pandemic, at least in terms of the public awareness about what's actually happening. This is a project I worked on with the New York Times to visualize what's happening in the classroom. As we all just sit around, breathe, talk, we're emitting respiratory aerosols. And as the figure shows, these tracer gases show that these respiratory particles from our lungs fill up a room much like cigarette smoke. They don't stop at some imaginary 6-foot buffer. They fill up the room. And I think once you see it, you can't unsee it. I think these kind of visuals really help to describe what's going on in the space. And it turns out, depending on the ventilation or filtration of the room, it could be as much as 1, 2, 3% or more of the air you're breathing in every space you're in just came out of the lungs of other people in that room. So we call the rebreathed fraction. So it makes sense. You want to try and minimize how much of that is occurring, especially if people are sick. We modeled this out to show what happens if someone's infected. In this case, we picked a student in the classroom emitting infectious respiratory aerosols, and very quickly you can see that the room fills up with infectious particles. You can see the overlay view over on the right here that the one person then fills up the room with enough, higher enough concentrations to infect many people. In fact, this is how we have super spreading events where one person may infect 70, 80, 90% of the people in the room. It's easy to see how that can happen when you visualize it. Also important in the visualization is what happens when you take simple steps, like in this case, opening up a window. So the gradients change, the buildup of the smoke changes. You still have localized pockets, but already we see the reduced concentration. In this model, we then add a portable air cleaner with a HEPA filter in the back of the room, and the combination of ventilation and filtration dramatically reduce the concentrations in the room. Can transmission still happen? Yes, of course it can, but you're no longer creating the conditions where super spreading, where one person will infect people even at the far side of the room. So we've learned our lesson, I think, from the pandemic. Before the pandemic, there was a lot of argument about how respiratory viruses were spread, SARS-CoV-2, but also influenza and RSV and others. But it's become quite clear that the dominant mode of transmission is airborne transmission, and with nearly all transmission happening indoors. That's important because once we recognize that, we can determine what controls are necessary. The goal of good ventilation filtration is not just to prevent or limit the spread of infectious diseases. There's also the many positive benefits around human health and flourishing and thriving. What's showing on the screen is a set of studies we did looking at adults and their cognitive function and indoor air quality. It's a set of studies we call the Cog Effect studies. This is the first one. Basically, we enrolled a set of participants to spend time working in this office environment, and we changed the air in subtle ways from the floor below without them knowing. And we tested their cognitive function at the end of the day. It's a double-blind test. And the results are really quite dramatic. Controlling for other factors, we see that across 9 cognitive function domains, when we provide a better indoor environment, better ventilation, lower chemical load, we see people perform better on these tests of higher order cognitive function. How do they seek out and utilize information? How do they respond during a crisis? How do they orient themselves to different tasks? How focused can they be on the task at hand? So this is an interesting finding, but then the question is, does this hold outside of a laboratory? So 2 years ago or 3 years ago, we started a similar study. We actually looked at to test people globally to see how indoor air quality impacted cognitive function. And sure enough, we see very similar results. And I've highlighted the blue box on the figure on the left. This figure shows the relationship between carbon dioxide, or CO2, which is a useful proxy for ventilation and an indicator of occupancy as well. And on the vertical axis, or the y-axis, is the cognitive function test called the Stroop test. Something really quite interesting here is that we see a linear response, meaning even at low levels of CO2, we see a benefit of better ventilation in terms of cognitive function now out in the real world. A new study of ours in the Cog Effect series that just published maybe 2 weeks ago, we extended this to think about not just tests of cognitive function and addition, subtraction, but also the other half of the brain, the half of the brain that's focused on creativity. And sure enough, we find similar impacts. In these buildings with better ventilation, we see improved performance on tests of creativity, controlling for all of the factors. That starts to paint a picture about how indoor air quality is influencing our ability of our brain to function on these tests of higher order cognitive function, addition, subtraction, and also our ability to perform creatively. So of course, what does this mean for schools? Well, of course, there's many adults working in schools, but also it's totally consistent with the full body of science on how good schools and indoor air quality influence student health, student thinking, and student performance. For example, there are many studies now showing that kids in schools with better ventilation, better air quality perform better on test scores, math test scores, and reading test scores, and other tests of achievement. So we see this over and over in the literature. It's not surprising. We see similar results for adults and kids. In fact, we see it for kids of all ages, from the very youngest in schools all the way up to the very oldest in schools, and for adults as well. So we know that ventilation and filtration, indoor air quality matter a lot to adult and kid health, thinking, and overall performance. So the key question then becomes, well, what are the standards that we're trying to achieve in terms of good ventilation and filtration? And this is an area that is starting to change and finally getting the attention it deserves. This is a piece I wrote in the American Journal of Public Health in August, looking at the history of ventilation, but as told through the lens of public health. And the short story is this: over 150 years ago, Florence Nightingale told us that the only defense a true nurse either asks or needs is fresh air from an open window. Right about that time, there was a physician scientist named John Shaw Billings in 1893 who set the first health-based ventilation target of 30 CFM per person, 30 cubic feet per minute per person. In 1895, ASHV, the precursor to ASHRAE, adopted this health-based target of 30 CFM per person. In 1925, 22 states in the US adopted this health-based ventilation target. However, in the 1970s, ASHRAE developed the standard for acceptable indoor air quality, where they lowered the ventilation rate by half or more. We moved from a health-based ventilation target to a target that was set largely to mitigate and control odors from humans. So we went from a health-based standard to an odor control standard. The standard for acceptable indoor air quality is objectively not acceptable. It's not a health-based standard, but ultimately that's guided a lot of the decisions around ventilation in schools and offices and everywhere else we spend our time. So the question that came up during the pandemic, I think we correctly called it early on in the pandemic, buildings would play a key role in mitigating spread. We needed to increase ventilation, improve filtration, but a question no one seemed to want to answer was, well, how much? What is that target? We had a standard for acceptable minimums that was unacceptable. We had targets from 100 years ago, the pandemic hits, and there was very little out there in terms of the specific guidance. Along with Shelley Miller at University of Colorado Boulder, we put out some guidance early in the pandemic on schools. We recommended that schools target 4 to 6 air changes per hour. This is in line with the ventilation targets that ASHRAE had published, but for healthcare. We published this in JAMA a few months after we released it for schools. But there's only a handful of guidance out there during the pandemic on these health-based or elevated ventilation targets. During the pandemic, I was a commissioner on the Lancet COVID-19 Commission. I chaired their task force on safe work, safe school, and safe travel. I worked with wonderful colleagues all around the world. And we all agreed that the current ventilation targets are too low. Everyone agreed that the ASHRAE standard for acceptable ventilation was too low. And there would be major public health gains for increasing the ventilation rate targets. There was general consensus around what those targets were, despite good scientific debate around which metric and what exact number. But there was urgency to move this conversation forward. We wrote a report proposing these higher ventilation rates to combat airborne respiratory infectious diseases. We used several different metrics. We provided the data in a good, better, or best format. And you'll see some at least one familiar number here, that 30 CFM per person. We didn't invent this. This is over 100 years old. That was first set as a health-based target. All of the literature since then has supported this as a target. This number appears in my book, written before the pandemic, came out right during the pandemic, 30 CFM per person as a health-based ventilation target. This isn't a mystery. All the science points to this as a good target, certainly well above the floor or not unacceptable, acceptable minimums. We worked with the White House and had the first ever summit on indoor air quality, where we presented this work from the Lancet COVID-19 Commission. The White House used this to work with ASHRAE, who several weeks after that agreed to develop their first ever truly health-based ventilation standard. The White House also worked with CDC, and just a few months later, CDC adopted some of this work from the Lancet COVID-19 Commission and others, and they put out their first health-based ventilation target of 5 or more air changes per hour. They chose an air change per hour metric. Some have chosen the volumetric flow per person metric of the 30 CFM per person. You can see in the red bubble I've highlighted here how we thought about it on the Lancet Commission, 4 to 6 air changes or 20 to 30 plus CFM per person. There's been a coalescing or an agreement happening with scientists all across the world. This is an article written by 40 of us, or 40 or more of us, published in Science, where you see the recommendation here. We recommended 30 CFM per person as a target for a health-based outdoor air ventilation target. So you can kind of see where we're going. We're actually returning to our roots from 100 years ago, getting back towards designing and operating our buildings for health. We had a really nice win just a couple months ago. The California Department of Public Health adopted the healthy building recommendations for California schools. And you'll see here in the note, they followed and adopted what was also put forward by the Lancet COVID-19 Commission. California Department of Public Health recommends for schools a minimum of at least 5 air changes per hour or 30 CFM per occupant per person, whichever is greater. Last thought, I'm going to pass it right back. This is a moment in time. Pandemics change societies in a million ways. One of the key lessons from the pandemic is we learned and got the message across that one, indoor air quality matters for a lot of reasons: infectious disease, cognitive function, student performance, student well-being, and health. And two, we know that existing standards are simply too low. They're not evidence-based, they're not based on health, and they haven't been for a long time. It is time to recommit to ventilation, not as a technical standard for minimally acceptable conditions, but as a cornerstone of public health. Thank you.
Wow, thank you so much, Dr. Allen, for sharing the latest research on making the health case for indoor air quality management in schools, addressing adequate ventilation to manage airborne infection risk. Our next speaker will be Hannah Carter. Hannah Carter is a project manager within the Center for Green Schools at the U.S. Green Building Council, where she supports school districts, staff working to improve air quality and create healthy schools across the country. Prior to joining the Center for Green Schools, Hannah Carter was the lead district-wide sustainability, Hannah Carter led district-wide sustainability efforts at Parkway School, at the Parkway School District in St. Louis, Missouri. Take it away, Hannah. Thank you for joining us.
Thank you so much, Sheila. So glad to be here, and really grateful for the background that Joe provided, because it's so relevant to the context of a new course that we're about to announce, or that we've actually recently announced. So as Joe laid the foundation, one critical outcome of all this heightened awareness and research around indoor air quality in schools really elevated the question of, how do we make it easier for school district staff to access all of this latest guidance and point them towards how they can take action and implement improvements. So really excited to announce that there is a new free online training course available that was developed by the Center for Green Schools, EPA, and other agency partners. And this course provides a foundation on school indoor air quality strategies, including ventilation, air filtration, air cleaning, and a framework for effective indoor air quality management. And for more experienced school operations staff, this course also provides a deeper dive into calculating those clean air requirements, verifying ventilation rates in school spaces, and additional strategies for periods of higher airborne infection risk, as Joe spoke to. A couple key things just to know about this course is that it's a self-guided 6-module course that you can start and stop anytime. And we anticipate it takes around 3 hours to complete. You can access this course completely for free and without a USGBC account. It is hosted on the U.S. Green Building Council website. But if you would like a certificate of completion noting your advancement in the course, you can create a USGBC account to get that course completion. And more information is available on the course webpage. So next slide. As a little further background into the course, as Sheila mentioned, I help lead our school indoor air quality leaders network of around 230 school staff from across the country working in school districts on indoor air quality. And through this work, we regularly convene and survey these staff to understand what are their greatest barriers to improving school indoor air quality, and use this information to inform the resources that we develop, like this course. So before we dive into the course, I wanted to quickly just share some of the key challenges that we've heard most recently from these staff about making improvements in schools, including increased employee turnover, aging infrastructure, gaining buy-in from leadership and other departments often can be a challenge. And then also a lack of capacity sometimes in their own roles, knowing that these staff that are responsible for indoor air quality wear a lot of other hats in their school district. Next slide. We also ask staff regularly about their needs for training and resources. And so through a staff profile survey we conducted in 2022, we found that less than half of the school districts that we talked to had a written indoor air quality management plan. 90% of the staff did not indicate that they had established processes in place to communicate or train their staff around indoor air quality. And also less than half of them had an established district level team in place focused on indoor air quality, but that all 3 of those were indicated as priority areas for them, something that they would like to achieve. Next slide. Additionally, we hope that this course can provide timely support as the current rates of acute respiratory illness causing people to seek healthcare needs in the US is at a high level. So on the screen, this is a snapshot of CDC data that was updated last Friday, the 31st. And we see that flu cases are increasing and COVID and RSV rates are also prevalent, pointing to the urgent need to pay attention to providing clean air in buildings, especially in schools. Next slide. So this course was developed based on the Clean Air in Buildings Challenge released by the US EPA. And so it focuses on those 4 principles laid out by the challenge, which are creating an action plan for clean indoor air, optimizing fresh air ventilation by bringing in adequate outdoor air, enhancing air filtration and air cleaning with proven technologies, and engaging your community in action and getting their buy-in and participation. Next slide. So as a quick glimpse of how this course is laid out, it starts with getting into how to make the case for explaining why clean air in schools is important, a lot of the background information that Joe provided, and also largely follows EPA's IAQ Tools for Schools framework that Sheila mentioned earlier. Then the course goes through technical aspects of ventilation, filtration, air cleaning, and indoor air quality monitoring. And it ends with pointing out where, when, and how to prioritize clean air in school buildings and some tips on how to engage your school community. So next slide. Dive in first here where the course starts by presenting some common indoor air quality issues in schools and provides data to help make the case for why there's a need to pay attention to these specific areas within a school building. It also points out evidence linking clean air with various student and teacher and staff outcomes, a lot of the facts that Joe mentioned earlier, including student attendance and teacher job satisfaction data. The course also touches on current and emerging issues affecting indoor air quality, such as wildfires and extreme weather. Next slide. An important aspect of making the case is also to communicate your value proposition to help get buy-in from leadership and the community for taking action towards indoor air quality. So the course walks you through this process a bit, and just as an example here, to walk through a goal that a school district might set would be around creating healthy learning environments for students and really stating that their program will assess and inspect HVAC systems for ventilation and filtration by installing indoor air quality monitors to monitor carbon dioxide levels and resulting in a improved clean indoor air within 2 years. So that's a very just generic example, but something that the course kind of walks you through. Next slide. So after this introductory section and modules in the course, we dive a little bit deeper into some technical aspects of improving indoor air quality. Next slide. So the main topics that we dive into are all developed largely based on CDC ventilation guidance and ASHRAE standards. So ASHRAE standard 241, control of infectious aerosols, is heavily featured, as well as ASHRAE standard 62.1, which is, we heard, sets the minimum ventilation requirements in schools and other buildings. And these sections also start by introducing basics about ventilation, those requirements and standards, metrics, but then it also dives into how to determine clean air needs, taking those measurements and conducting those assessments, and then enhanced continuous monitoring where available. The course also goes into a little bit more detail on filtration and ends with a brief discussion on air disinfection, including a feature on germicidal ultraviolet or GUV. Next slide. Throughout the course, you'll find relevant documents that you should be aware of, such as this 2023 review of state policies on school ventilation, published by Environmental Law Institute and others. Next slide. And as I mentioned, this course also dives deeper into how to calculate outdoor air ventilation rates per standard 62.1. and presents both the CDC and ASHRAE's view on how filtration and air cleaning adds to the overall clean air provided to buildings. There are many examples and test your knowledge activities throughout explaining the different metrics, like equivalent clean air changes per hour, EACH per CDC, or those volumetric per person equivalent clean air flow rates introduced by ASHRAE standard 241 and defined through calculations. Next slide. Next, this course dives a little bit into indoor air quality monitoring. And so carbon dioxide, CO2 monitoring is one way to determine whether there's sufficient outdoor air being provided into buildings. And so this course goes into useful tools that schools can use, such as this NIST quick indoor CO2 tool that estimates the expected peak carbon dioxide levels given specifics about a space. In addition, the course also links to other resources, including EPA's Air Sensor Toolbox and EPA's low-cost air pollution monitors resources for schools wanting to learn more. Next slide. During the pandemic, many schools upgraded or considered upgrading to high-efficiency air filters like MERV 13 in their HVAC system. So this portion of the course reminds school staff about what MERV ratings are and what they mean in terms of particle removal efficiencies. It also points out useful resources like the Center for Green Schools Indoor Air Quality Fact Sheet series, and dives into the use of portable air cleaners that use HEPA air filters that we know continue to be used in schools as a helpful tool to reduce viral transmission. Next slide. Throughout the course, we also highlighted where improving clean air in schools is most likely to bring additional benefits beyond just addressing airborne infection risk. So for example, this National Academies of Sciences, Engineering, and Medicine consensus report from 2024 concluded that there's ample evidence that exposure to indoor fine particulates can cause adverse health effects, which suggests that reducing indoor PM by improving filtration, such as through high efficiency HVAC filters or portable HEPA units, will likely bring more benefits beyond just lowering airborne infection risk. Next slide. And then in closing, the course does point out ways to prioritize action given limited resources that schools are faced with and how to bring the most benefits. EPA's framework suggests paying attention to high-risk areas such as nurses' offices and densely occupied spaces, and during elevated risk periods, such as currently. And so in addition to ventilation and filtration, schools can implement a layered approach beyond building engineering controls. And last but not least, the course gives some specific suggestions, such as communication strategies, feedback strategies, making your work visible for how to get your community involved, gaining buy-in, and finding strategies to implement clean air in school buildings. So thank you. That's all I have.
Wow, Hannah, thank you so much. That was wonderful. It's helpful to see how the new online training course is demonstrating research into practice, guidance, and training for staff. The Clean Air in Buildings Challenge new online training is an exciting tool for school facility staff. And thank you so much, Hannah, for sharing your story. So our next speaker is Joni Ricks. Joni Ricks brings a wealth of knowledge in running successful environmental programs in school facilities and has been the environmental program manager at Denver Public Schools for the past 22 years. Prior to that, she was an environmental specialist for Boulder County for 10 years. Thank you for sharing your story of how Denver Public Schools is proactively managing IQ to create healthy school environments. Joni, take it away.
Okay, thanks, Sheila. Wow. I mean, after hearing all the science and the resources that are out there for ventilation, I'm going to touch on how we at DPS are managing IAQ and have taken some of that science and applied it to DPS. And I think you'll probably hear a lot of the same themes now listening to the other speakers as far as what to focus on and prioritizing certain things, et cetera. Next slide. So first, an overall snapshot of Denver Public Schools. Denver County School District 1 was established in 1903. We have about 90,000 students and 15,000 employees. Fun fact, there are about 170 different languages spoken by staff and students, and 36% of our students are English learners. And as a large school district, urban district, 62% of students would qualify for free or reduced lunch. Currently, Colorado provides universal free lunch. The district maintains about 200 buildings. The oldest school pictured here is Dora Moore, which was built in 1889. And yes, this building is on the list of Denver haunted places. And to the right is our newest and first all-electric school, Rasa, which just opened fall 2024. The average age of our buildings are over 55 years old, with the majority built in the 1950s and 60s. And many of these older buildings did not have air conditioning. So a large chunk of our capital planning work the last decade has been retrofitting and upgrading HVAC systems to add air conditioning and ventilation. For our 2024 bond, we'll be air conditioning the last remaining 20 buildings that are currently without AC. And finally, I want to call out that DPS has 6 core values along with our ends policies that guide our work. And I highlight students first and equity on here, as that is the area that the majority of my and my team's work seems to fall under, or where we focus our work, always trying to think of students first. Next slide. Drilling down a little bit further, specifically to the environmental team, we are a team of 6, a manager, 1 asbestos project manager, 2 environmental specialists, 1 environmental tech, and 1 admin. The mission of our team is to promote sound environmental practices and ensure a safe and healthy environment for the staff and students of DPS. And this is accomplished by facilitating compliance with state and federal environmental regulations. So much of what we do that you see on this list of responsibilities is driven by regulation, like ensuring that asbestos abatement projects supporting construction is managed safely and in accordance with EPA and Colorado regulations, or that off-spec science chemicals are properly disposed of as hazardous waste. But we also get involved in any sort of environmental health issue in our schools that don't have regulations as well, which is where that indoor air quality piece falls. We are spread thin, probably like many school districts, based on the size of buildings and responsibilities that we have. But also being small, I have to give kudos to my team as we all work together to get everything done. Each person has kind of their niche, but will jump in whenever needed so that we can address issues quickly. Considering that when I started, I only had 1 coworker who did all asbestos work and I had everything else, being able to show the need to expand the team and do more work in-house has been an accomplishment and something that's supported by some of this science work. Next slide. So turning specifically now to indoor air quality management, since that's the focus of this webinar, here's kind of a short timeline of the last few years. Since I started, I've always wanted to do something more proactive around indoor air quality, and over the years attended EPA's Tools for Schools trainings online and in person, and had an internal IAQ council for some time, and did some smaller focus projects around asthma, school walkthroughs, and other IAQ issues, et cetera. But still overall, definitely more reactive than proactive. Partly because I was a staff of 1 for many years, and all those other areas and responsibilities sometimes had to take precedence. And then, kind of as referred to earlier, COVID happened. And COVID brought new and renewed interest to indoor air quality in schools. As staff and students began discussing returning to buildings, we fielded many calls about the ventilation, the filtration in our schools, questions like how many air changes per hour? Can we buy HEPAs for all the classrooms? What has the district done to improve systems? What are the classroom CO2 readings, et cetera? We had absolutely none of this data or information. With COVID, we also saw advances in the technology around indoor air quality monitoring, smart buildings, and then just overall interest and investment in indoor air quality. So for me, the time was like finally right. In 2020, I was approached by CU Boulder and Carrier asking if they could conduct a demonstration project for the effectiveness of HEPAs at reducing particulates and measuring air exchange rates. I star this project on the timeline because it truly is the foundation and the catalyst of where we are today or what has followed with our IAQ management. Major highlights over the last 5 years was then being able to get real-time IAQ sensors, getting additional HEPA units, and the CDC study that's currently ongoing. You will note that each of these are incremental steps over time, not at once, and is a continuous work in progress. Much like the fable of the tortoise and the hare, slow and steady wins the race, especially in a school district. Next slide. So the purpose of the CU HEPA project was to show that right-sized HEPA units in classrooms would reduce the number of particulates in the air, and that in turn would reduce infectious aerosols and asthma triggers. The buildings or schools initially selected for this project were a mix of grade levels, different ages of buildings, and types of HVAC systems, central systems versus univents, which are very common in schools, and also schools that had a higher prevalence of asthma, those that are greater than 10% or above the national average. Initially, 25 schools were selected, and then since only elementary level kids were being brought back to the buildings after COVID, the focus shifted to elementary buildings. Classroom testing of air changes with the CO2 decay method eliminated some additional schools and classrooms as we found that they had adequate or good air exchange rates. In the end, 17 buildings with 3 to 6 classrooms in each school was selected and fitted with a Carrier HEPA unit and near real-time IAQ sensors to measure particulates and other basic IAQ parameters. Overall result was that air monitoring and testing showed that the air purifiers were able to reduce airborne particles on average by 50% compared to classrooms without air purifiers. Next slide. So what else did we learn or gain from the CU HEPA study? Early in the pandemic and prior to this work, the district had decided that we would not provide HEPA units to all classrooms. Covering 10,000 classrooms would have been a challenge logistically and a couple $1 million in cost. Even with ESSER funds, we had other HVAC priorities such as upgrading filters and making sure systems were working properly. Schools and parents wanted to pursue getting them on their own, but we also messaged that due to equity concerns across the district, we couldn't allow individual schools to do that. Then in fall 2021, the Colorado Department of Education had federal funds for HEPA units. So I was able to persuade leadership at that time with this data to provide air purifiers for nurse cot rooms and in music rooms, both areas that were considered to be higher risk. Then still wanting to be more proactive around indoor air quality, using the air sampling results and showing how low cost portable real-time sensors were used in that study, I proposed getting sensors. My original plan was to purchase about 40 to 50 sensors that we would install in a school for a few weeks, perform an IAQ walkthrough, and then report to the school the results and actions that they could take to improve indoor air quality. This would have taken probably 5 to 6 years to get through all schools with the time and the size of the environmental team. So with the business case of options and the support from the COO at the time and the executive director of facilities, they agreed to fund permanent installs in 10% of classrooms, which is about 800 sensors. This is a great place to start and would cover each region and every school in the district, and per guidance from Dr. Hernandez with CU, would be statistically relevant. The following year, CDPHE had the Clean Air for Schools grant and had funding from CDC for air purifiers along with IAQ sensors for any school in the state. 86 DPS schools took advantage of this program, and we received an additional 400 IAQ sensors from that. So now we have some schools that have 20% of classrooms covered. And by participating in this project and connection to CU Boulder, it opened the door to the current research project with CDC and CU Anschutz and CU Boulder. Next slide. In 2023, CU Anschutz submitted a proposal to the district's research review board. The official title is Multi-Year Study to Determine the Causal Link Between HEPA Filtered, Unfiltered Indoor Air Quality in Occupied Classroom Settings and Human Respiratory Disease Outcomes. While CU Boulder did the study on the HEPA units and air quality during COVID, CU Anschutz was involved in a CDC Test to Stay program, which allowed students to stay in school if they tested negative for COVID and did not have any symptoms. There is limited data on the direct impact of air quality engineering interventions on the reduction of viral transmission. And so this proposal and study brings together both of these to study that link. The study is 2 years of observational work and then 6 months of data analysis to tie building and human health together. Next slide. So the questions that they are hoping to answer is if there is a relationship between IAQ and absenteeism, and if air purifiers have an impact on absenteeism, and if there are air purifiers, are there less pathogens? How are they going to do this? One is using those continuous IAQ sensors that measure those parameters and particulates in the classrooms across Colorado with and without air purifiers. Schools have been matched by size, location, grade levels, and then ones that have purifiers and ones without. They will obtain school absenteeism data and compare to portable air cleaner deployment, and then measure the occurrence of positive respiratory viruses through multiple seasons with the nasal swabs of participating students, as well as desktop swab samples. Then they will take all that and try and tie it together to show the link between selected air quality parameters, specifically particulates and CO2, and human disease. Next slide. Just a little bit more about the desktop swabbing. PCR, which looks for genetic material from SARS, RSV, and flu, started in spring 2024 at Denver and one other school district in the state. Students swabbed a total of 30 schools and 70 classrooms and collected 10,300 PCR swabs. This fall, the swabbing started again with 4 school districts in the state, a total of 20 schools and 80 classrooms, and they're expected to collect about 10,000 swabs again. Next slide. So the desktop sampling project ends May 2nd, and then by August, all swabs from phase 1 and 2 will be analyzed. So far, about 7,000 swabs have been analyzed, and about 4% of them have been positive. Then starts 6 months of data validation and review to answer the study question of what is the impact of air purifiers on absenteeism and on germs. Next page, or next slide. And so switching gears, I just want to touch on the benefits of school districts participating in studies like this. Lots of text on this slide. I know I'm not going to read it. But the point is that we looked at this study and we could identify benefits to different divisions across the district, sustainability, operations, nursing, and it also aligned with our district ends policies, which are what DPS's long-term goals are. At the beginning, I touched on the district core values. And like I said, we also have our ends policies or long-term goals that involve equity, academic success, student and staff well-being, health and safety, post-graduation and global citizenship, and climate action. I know that school districts can kind of be closed systems, and in the past, DPS was not as open to research or outside worker help, but these types of studies can help provide the data that's needed to move initiatives forward. In my case, past work and this work has helped me make the case for the district-wide IAQ monitoring, as well as adding an additional staff member. Next slide. Just to touch on why we have taken the path of installing sensors. And basically, back to my very first slide, I think I had on there, it's like you can't manage what you don't measure. Past or completely reactive IAQ monitoring is a snapshot in time. Continuous monitoring will provide trends, historical data, and pushes us to that more proactive point with a well-defined IAQ management plan. The first 2 items on this list are the main kind of long-term goals of the sensor network. And as we heard from Dr. Allen, numerous studies have shown that elevated CO2 impacts productivity and cognitive performance. Particulate levels, especially 2.5, impact younger children and especially those children with asthma. If you can control particulates, you can control potential asthma triggers, and as we think, viruses as well. and then ultimately reduce absenteeism, which is such a key critical measure for student success. So far, we have used the sensors for temperature checks in these non-air conditioned schools in spring and fall. It used to be a very manual process. The FM had to walk to the classroom, check the temps 3 times a day, and then record it on a spreadsheet. We've dealt with a dust and particulate complaint at school. We were able to use the sensors to provide graphs and historic info to show that levels inside were the same as outside or lower. At one point, we noted excess humidity at a school, which notified us that there was probably a broken pipe in the school, as the humidity had shot up to 80%. Colorado is a very arid climate, so our humidity rarely climbs above 20%, especially not in the winter. And that allowed us a quicker response to the issue. And school indoor air quality concerns and complaints. We can give a baseline report on indoor air quality if there's a sensor in that room. And this is where they've been really super valuable so far. More for the customer service, staff well-being part of it. People want to be heard and they appreciate our quick response to their concerns. Next slide. Just quickly, looking further down the road, we can use this data to plan for building upgrades. We can evaluate the system operation. We can look at the controls and how the building is running through its flow. We can set alerts, and then we can also take action. And that's something to plan for in the future, not where we're at this point. And another, for example, at one point, if we saw elevated particulates outside from a wildfire event, schools could be messaged to stay indoors and use HEPAs, et cetera. Next slide. So that is my 5-year IAQ journey here. So I'll just leave you with this last quote here from EPA, and thank you.
Wow, thank you, Joni, so much for sharing your story. Thank you so much for sharing the exciting approaches to IQ management, ventilation, and filtration that you're using throughout Denver Public Schools. And a couple of things that I love where you have, I thought I was signing up for German class, not germs in class. And my favorite, which we've used often, you can't manage what you don't measure. So thank you so much for sharing your story. So to learn more about all of the great resources shared today and to stay up to date on the latest best practices and success stories on school indoor air quality, sign up for the EPA IAQ Tools for Schools email updates. You can use the QR code. I'm gonna pause for a moment in case people want to get their cameras out and try to capture that QR code. And we've also included the link in the for the sign up in the chat. Next slide. So we hope that you have heard actions you can take to reduce airborne viruses in schools, optimizing ventilation and filtration improvements, the use of portable air cleaners, and energy efficiency. For your next step, please fill out the optional webinar evaluation form to help us better serve and support your needs. At the end of the evaluation, please access your personalized certificate of completion and display it as a demonstration of your commitment to take action for clean, safe, and healthy school indoor environments. Next slide. So this concludes the presentation portion of the webinar. Don't go anywhere though. Thank you for attending the webinar. Please continue to stay online for the question and answer segment with our speakers and panelists. And at this time, I would request that the speakers and panelists who can come on screen, please come on screen. And I'd also like to introduce our panelists, Jordan, Zambrana. He's a biologist with the EPA Indoor Environments Division, so I get to work with him all the time. He's been with EPA since 2015, and before coming to EPA, he was a fellow at the Centers for Disease Control and Prevention. Jordan's educational background and training is in microbiology. He has a Master of Science in Applied and Environmental Microbiology, as well as a Master of Public Health degrees in both environmental health science and epidemiology. Thank you so much, Jordan, for joining us. Okay, so I think we have some questions. So please don't leave yet. My audience members, let's see. I'm just going to start with the first question that I have here. This is directed to Dr. Allen. Thank you for continuing to be here with us, and thank you for your presentation again. So it says, what do you suggest for a call to action for large school districts, 150 plus buildings, that need to have a proactively versus reactively managed IEQ program? Did you catch all that, or do you need me to go over it again?
It's a great question. And I think there's a handful of things I do. First, I think you have great examples here. You just heard what Denver's doing. I follow their lead. It's terrific. First things I tell people to do is commission your systems, right? This is like giving your building a tune-up. This doesn't happen a lot in most buildings, and I think it's one of the first steps, because very much like Joni was talking about, you need to know what you're facing. What is the status of your systems? What's going to need replacing? What just needs a minor tweak? Commissioning saves energy, therefore it also saves money, and improves indoor air quality. So I think giving your building a tune-up, commissioning is the absolute first step. Second, I love what they're doing in Denver. Boston Public Schools is doing this too. You cannot manage what you don't measure. So I love the idea of putting in these real-time air quality monitors. That's also actually going to help you direct your resources most effectively. Look, a lot of times when we do this monitoring, we find some classrooms and places are just fine. And so you start to target the rooms and locations that need that extra help. Then I think it's getting to some of the basics around good ventilation and filtration. I think if you just tackle those, that gives you the roadmap. You can save some energy. You figure out what the status is of your building, and then you can most efficiently target what resources you have. We know time and money are both limited. But I think that's where I'd suggest as a starting point. And really, you have models here in Denver and elsewhere that are really doing a nice job.
Thank you so much for that, Dr. Allen. Would any of the other speaker panelists care to add or affirm or confirm what Dr. Allen just said? Okay, nothing to add for that one. Okay, so our next question, and this is directed to Jordan. How do you implement MERV 13 filters into old HVAC equipment without putting stress on motors and drives, VFD drives? Did you catch that, Jordan?
I did. Yeah. So
okay.
What I would say is what we would recommend is to evaluate, work with a professional to evaluate the kind of most high level MERV filter that your HVAC system can accommodate. And if you cannot, if you find in consultation with a professional that you cannot accommodate, say a MERV 13 or at least a MERV 11, but you still want to improve filtration within your individual buildings or classrooms, then I would say your next step is to look at individual air cleaners in the room generally. So yes, we do not want you to, we would not advise to just kind of add MERV 13 filters ad hoc without evaluating what your system can handle. And we would say definitely consult with a professional when deciding what your system can handle.
Thank you so much, Jordan. Would anyone like to add, or would anyone like to speak to that question as well? Okay, so Hannah, I'm looking at you. Can your courses be imported onto a school district's learning management system for access to a large population of educational building operators and maintenance and repair staff?
That's a great question. I'd love to work with that asker one-on-one to see how we can help support. But the course is easily accessible just through a quick hyperlink that can also be shared broadly. So that's another option.
Okay, great. Thank you so much for that. Okay, Joni, is the Colorado School District on 100% outside air? How are you mitigating conditioned air like heating in the winter without taking the boilers, and in the summer months, air conditioning to relieve stress on the chillers and the pumps? Did you catch all that, Joni? You want me to go over it again? It was several questions in here.
Yeah, so I think the first question is the district on 100% outside air?
Yes, that's
And
the first question.
no. A lot of our rooms, we have univents, so every classroom is right a little bit different. And so they're set at maybe 20%. And then there was a question in there about boilers and chillers.
Yeah, so let me go over that, the other part of the question. How are you mitigating conditioned air like heating in the winter without taxing the boilers? And in the summer months, air conditioning to relieve stress on the chillers. So they're talking about winter and summer. How are you handling these things?
Yeah, Colorado is tricky because we can have such massive swings in our temperature. It's very dry here, but it also, it could be 70 degrees one day and then it could be really cold at night. So within that, then our HVAC shop is just kind of set very specific kind of parameters that they try to keep the boiler between, 68 and 72. It runs from the months of October to May. And then if they have air conditioning or chillers, then those work at the other, time, basically summer through early part of fall. Hopefully that answers.
Thank you so much, Joni. Okay, let's see. Our next question, I'm going to send over to Joni as well. Do you have any plans to focus on energy management impacts or implications as part of your study, and or coupling the study with things like energy efficiency upgrades?
So the CDC study is not going to touch on that. Actually, sustainability is a different group from what I'm in, and they are the ones that deal with energy. And so they are doing a lot of work around that and around fault detection diagnostics and working on energy. Any of our new buildings that we're building, we're trying to work in the, highest energy efficiency that we can in our buildings.
Okay, thank you for that response. So Hannah, does the Center for Green Schools have updated resources for federal, state, and local funding and grants available related to IQ investments? This is always an issue where the information is very ad hoc and changing. Could there not be a searchable database or even an updated Excel?
Yeah, that's a great question. The Center for Green Schools did do a mini series around funding last summer, and we put out some resources related to federal funding and pointing school districts to grants and other resources that were available. Funding sources are always changing, so it's definitely important to just stay up to date with the latest. And there are a few other conveners of national level resources that we can point folks to, so we can include that in some follow-up information. And all of our publications related to funding and past webinars are available on our education site.
Thank you very much for that reply and that feedback. Okay, Dr. Allen, the California Department of Public Health adopted the increased ventilation targets, yay, for all schools. Do you know of any other states considering adopting these targets?
Yeah, it's a great question. There's a lot happening, particularly at the state and city level. So I know there are discussions happening. There were some in Massachusetts, there's some in New York. Around the country, there are these conversations are happening. There's a big policy effort underway to kind of advance some of this. I'm really glad California did it. One, it's a massive district. And they took a leadership position, which is good. And you know, we're starting to see the line. I think the big thing here is we're starting to see alignment on some of these targets, despite people's varying different preferences for what they are. CDC has a target. California schools adopted this. You see the scientific community lining up. You see new standards coming forward. So there, I don't have any insight into like what state goes next, but there is a lot of activity right now. I think a lot of it's happening at the state and city local level.
Thank you so much for sharing your insights. So still, Dr. Allen, on you. In one of the human studies that you shared, it seemed like there was a particularly striking discrepancy in the information usage column. And so the person is asking if you could expand, on whether or not the researchers also saw that as a particularly noticeable, and what is meant by the term information usage.
Yeah, so really sharp-eyed person out there. Nice comment. I think for me, so information usage is basically, this is an 1.5 hour long cognitive battery, and it's really descriptive. This is how people seek out and utilize different information. This is a simulation a tool we used as a simulation tool, where we put people in the role of, say, a city mayor, and then they're presented with different challenges. So it's exactly that. How do you seek out, utilize information? How do you apply it to different crises and activities that happen during the day? I think it's a good observation, but I think the bigger takeaway for me is less about which specific cognitive domain. It's more about the consistency across all of the congruent domains. And in that case, I'm talking about across studies here even. So even in those 9 cognitive domains I showed, there are these things looking at how we respond to congruent and incongruent stimuli. We've seen similar things from kids and straight math tests, reading tests. We've seen it from standardized test scores for adults and these different creativity tasks. So to me, I think it's a little bit less about these, what I think are minor differences. They look a lot in the graph between specific cognitive domains and tasks, and more this kind of bigger picture that's broadly painted, which is that it's influencing brain health in multiple ways. By the way, we also know that indoor air quality influences brain health in another way. It influences our mental health. There are links between things like outdoor air pollution and anxiety, depression, suicide ideation, and we know that outdoor air pollution penetrates indoors, the extent of which is depending on how well our buildings are designed, operated, maintained, and the level of filtration. So we can make a link to indoor air quality and mental health, cognitive function, performance on test taking, creativity tasks, and also overall mental health and well-being. So the indoor air and what we do about it is actually having this big health impact on our brain in many different cognitive domains and tasks. But I think the big picture tells, quite honestly, a compelling story for why we need to design, operate our buildings differently and get away from these minimum standards up to these newer health-based standards that are actually historically very old. Get back to our roots.
Thank you so much, Dr. Allen. So Jordan, we have a question here. Are schools still in pandemic mode?
So pandemic mode would refer to kind of a mode of operation in ASHRAE 241. That's what I'm surmising the question refers to, anyways. And so
yeah, it says are schools still in pandemic mode? I'm not sure if I said it correctly.
no, that's okay. No.
Okay.
So broadly within ASHRAE 241, it discusses there being kind of a different mode of clean air equivalent when you switch into what is known as the pandemic mode. And so that is deliberately in the ASHRAE 241 left up to kind of the cognizant authorities is the language that they will use. And so it's meant for individuals and systems and governments, local governments or state governments, whoever's implementing ASHRAE 241 to decide when it is kind kind of best for them to implement pandemic mode. Dash Rate 241 is not meant to be, is not as written, is designed to be constantly in implementation mode. It is meant to be an on and off sort of thing. And when you do that is subject to discussion.
Okay, thank you very much for sharing. Excuse me. Joni, we have a question for you. Where can we get more details of the CDC CU study?
There's not a lot out there just yet, but I think there might be some published information. I'll have to look. So sometimes with research studies, because the goal is to publish a paper, they will tend to kind of hold that information pretty close. So you don't always get it until the end of the study when it's done.
Okay, thank you. Next question. Let's see. Again, this is addressed to Joni. Any experience with proactively monitoring IAQ with real-time direct reading instrumentation linked to a cloud network for data management? Also, any experience having these instruments paired with building HVAC management systems via API?
So the only instruments that we had prior to these wired or real-time ones were the handheld instruments. And those basically just collect the information inside the device, which you then would later end up downloading, like a Q track or something like that. And we do not have any of them connected to our BMS system yet. Not all of our schools have controls either. So that's another thing that we have to work on upgrading. And so that is kind of one of those longer term goals to hopefully do. So hopefully that answers that question.
Thank you so much. Okay, Dr. Allen, let's see. How do you respond when people raise questions about the tension between IQ, ventilation, and greening or energy conservation efforts?
So I think this is the challenge of the moment and the opportunity of the moment. And the way I respond is this: I don't think, well, I don't think it is unacceptable to have an energy efficient building where people are getting sick inside. Let's just stop right there. We've done this for 40 years. We prioritize energy efficiency at the expense of people's health. That's a problem. It is also equally unacceptable to have a building that's super healthy and ignores our responsibility to what's happening with the planet and around our energy usage. I think the setup in the question reveals the problem. It's been presented as either or. There are many examples in schools, offices, homes, and everywhere else where you can design and operate a building that does both, provides a healthy indoor environment that is energy efficient. So, you know, we've been in the sick building era for a reason. I think we've approached our buildings as an afterthought when it comes to kids and teachers and adults' health. It has led to big problems. And in fact, now we're trying to fix a lot of these problems, and it smacked right into our face when the pandemic hit and we had all this spread happening indoors and a building stock that was not designed to manage spread indoors. It's quite frustrating. And this is where I'm actually uplifted that I think coming out of this pandemic, we have a moment to get this right. It is not hard. The technology exists. Technology exists. We know what to do. We know how to design a healthy building. We know how to design an energy efficient building. The two sides haven't always talked. If you look at the standard setting bodies, there are going to be all sorts of standards on energy efficiency in buildings, and there are going to be standards for weak indoor air quality standards. Those aren't talking. We have state and city level building codes and energy efficiency codes that are focused on health while ignoring energy. We have energy codes happening in buildings and states and energy targets that are ignoring what happens to health indoors. It is just a broken and dysfunctional system at the moment. You hear me get excited about this, talking about it? We actually have a moment to fix it. We know what to do. The tech is there. And the benefits, let's just talk about the benefits. the benefits are enormous. You've seen these studies that show if we improve indoor air quality, there are benefits to the US economy. This is jobs in the economy. $20 billion to the US economy if we get these simple improvements done in our buildings. That's not even including the energy efficiency gains. It's an absolute no-brainer to do this. You want to lift kids' test scores up. You want to make them perform better, be less sick less often, be resilient to future pandemics. These are absolutely no-brainers. They're not expensive. What's expensive are kids and adults getting sick in buildings because we're not treating our buildings as tools to promote health. That's fundamentally what's happening here. And we've been answering the same question over and over. What's the balance between health and energy efficiency? How about no balance? How about we do both? Because we can and we know how to do it. Sorry.
No, that was great. Thank you so much. Yeah, it doesn't have to be either energy efficiency or our indoor air quality. They can both work together, definitely. Would anyone else like to speak to that question?
Yeah, I would just echo what Dr. Allen had to say, and that often these improvements to improve, improving indoor air quality and the system upgrades, the changes that we're making to our buildings, improving the building envelope, improve the energy efficiency and reduce costs. So it's often a win-win situation.
Right. Thank you, Hannah. Anyone else? Okay, I think we have time for maybe a couple more questions. Let's see what we got here. So, excuse me. Can Dr. Allen speak to equivalent outdoor air, which allows highly filtered, recirculated air to be considered as being similar to fresh outdoor air? What is the minimum filtration efficiency required for filtered recirculation air to be considered equivalent outdoor air?
Yeah, it's a really good question.
Did you get that? Okay.
Between ventilation filtration, I liked what Jordan said, right? You want to get the maximum grade filter that your system can handle. Most systems can handle MERV 13, especially the low pressure drop MERV 13 filters. There's a push in some corners to say, hey, you know what? We can actually, let's say, close off outdoor air ventilation and just clean the air over and over inside. I think that's a little naive, to be honest, in terms of what we know about the science of what keeps us healthy and functioning well. The theory is, hey, we don't need outdoor air if we just clean the indoor and make it as clean as possible. It assumes we know exactly what to clean. It assumes we can effectively clean it. And it ignores, honestly, a lot of the scientific evidence that just shows benefits associated with higher outdoor air ventilation rates, inclusive of everything that means. So I'm hesitant. I wouldn't go one or the other all the way. I think it's a combination of good ventilation, good filtration pickups, especially when outdoor temps are extreme and you're going to have to close the outdoor dampers a lot, not all the way. But I think with good filtration, most buildings can do this, at least get up to a MERV 13 with the low pressure drop filters. And as Jordan said, if you can't, for some reason, the portables are really quite effective. They're getting good. You got to watch out for noise, find a low noise, high clean air delivery rate portable air cleaner that can be quite effective. I also don't think the solution here is to have these portable devices plugged in everywhere. People turn them off. They don't use them all the time, but they're a nice stopgap measure, and particularly in places or classrooms where you can't do much, or during pandemic-like conditions where you have high levels of influenza circulating, or whenever that next pandemic hits, if it's a respiratory pathogen.
Thank you so much. Would anyone else like to respond to that question as well? Any thoughts? Okay, so I think for our last question, I just want to make one comment that the Environmental Law Institute and organizations like the Healthy Schools Network are a good resource to follow for policy action at the state level. So the Environmental Law Institute and Healthy Schools Network, they can be your go-to for what's going on at the policy level, at the state policy level. Okay, so this question is drilling down to my children's school district installed IQ sensors in every classroom. Maybe I should say the school district. Montgomery County, Maryland, installed IQ sensors in every classroom and other spaces that measure CO, CO2, PM 2.5, PM 10, and O3, TVOCs, temperature and humidity. we are working with our facilities department to develop a threshold table of low, medium, high thresholds for each of these indicators. Have any of you created a table like this? So that's for any of the speakers or all of the speakers. That was a loaded question. Do you need me to go over it again? Okay.
I'm happy to weigh in, but I'm curious what Denver's chosen as thresholds. I think it's a really important question, and lots of devices have their own internal thresholds. Essentially, you're setting a risk-based number when you're choosing a threshold. I have some thoughts, but I'm really mostly curious to hear how Denver is actively doing it and others. So I'm happy to chime in.
Yeah, so one of the tricky things about indoor air quality, like we were talking about energy efficiency and how there's codes and everything, since there are not hard, fast regulations around indoor air quality, the standards are kind of pulled from a number of different places. And so like we might use, the World Health Organization to set a standard for one thing. We might use ASHRAE to kind of look at the parameters for something else. And there's also then our internal kind of standards. So a lot of them are around like kind of comfort standards and kind of what's kind of out there as far as best practices or kind of what's been published at this point. And I think actually, Berkeley, I think they have been working on kind of trying to come up with some kind of parameters on that as well. Is that right, Hannah, you think?
Yeah, I believe they have some, there's a new report coming soon. Yeah, I would just add to that, Boston Public Schools is pretty well known as being a leader in indoor air quality monitoring. And they have a very public document up on their website that walks people through how to make sense of the dashboard that they have online and explains the thresholds that they've set for themselves. So for other districts looking for an example, they're one large school system to look to, as well as Denver.
Dr. Allen, you want to weigh in on this?
No, I really like the answers people gave. I think this is a confusing landscape at the moment. I think it's a really important landscape. I think there are all sorts of numbers out there from every different organization. I actually think it's a call for a EPA and or others to summarize and synthesize what is out there. California EPA has their own numbers. EPA has their own. ASHRAE has their own. The certifications have their own. WHO, there are risk-based targets, there are screening level targets, there are occupational exposure limits. I taught a class this morning, my healthy buildings class at Harvard. We spent time we had probably 40 different numbers on the board in an exercise talking about what would you do about formaldehyde levels. It's a confusing landscape. I think it's probably worthy of an entire webinar on this, to be honest, about how do you interpret the indoor air quality data. A lot of what I see out there, to be honest, isn't that great. And I think it can be tricky. So that's not a good answer for right now. We're out of time. I think it would probably be worth, honestly, a good hour discussion on these thresholds and how to interpret the data and how to analyze it. It's a big lift.
Well, thank you, Dr. Allen, for giving us some thoughts about our next webinar. Jordan, any last words from you?
I would just add that Dr. Allen, Joni, and Hannah all gave great answers with regards to kind of the status of where we are right now, with regards to kind of the varying resources out there for setting standards and looking. It's certainly something from a research perspective that needs to be drilled down on and tackled on a little bit more. And I think will most definitely be the future of things to look at.
Well, thank you all so much. We are at time. I am so grateful and appreciative that you all came today, and our audience members. I'm so grateful that you all also came and joined the party with a purpose. So thank you all so much, and we look forward to continuing to do our work to create healthy indoor air in schools. Thank you all. Have a great day.